So you know that squat assessment that you do every single time with new patients to see what their form looks like? And then once you see it, totally disregard it? In this video, I want to share a framework that helps you redefine that squat assessment. So it not only helps you understand the biomechanics of a squat, but it helps you understand why your patient's in pain and what we need to do about it from an exercise perspective. So let's break it down on the whiteboard, and then we'll go over specific examples as to what exercises we can do based on how our patient is squatting. So when it comes to our squat assessment, instead of just globally looking at it and just looking for big red flags, I want you to change that mindset and think of it from a trajectory standpoint. We want to start looking at how is the trajectory of that person's squat? Are they moving H for horizontal, or are they moving V for vertical? So horizontal, we're thinking like an escalator. Vertical, elevator. Horizontal, usually they get to about 90 degrees and then they just hinge back. So their whole body's going back. Where vertical, usually they can get the full range of motion. Okay, so maybe you're already looking at trajectory and understanding how that may relate to the person's pain. From here, I want you to think of the posterior pelvis, aka the backside of the pelvis, thinking glutes, upper hamstrings, external rotators, these things. Okay? And from that, I want you to think about unlocked, locked. When someone moves in a horizontal trajectory during a squat, they are telling you that the posterior pelvis is unlocked. Imagine if you had to walk through a door. If it's unlocked, would you be able to get through the door? Sure. You'd walk right through it. That's what's happening here. Unlocked, we're thinking eccentric. So the tissues are more eccentrically oriented, and so when a patient goes to squat, they can start maybe nice and vertical, but because they have space back here and a door to move through, they move in that direction. Conversely, if we're working with someone and see someone that's more vertical, they are more locked, that's more concentric. So they're more concentrically biased. That means that there's a locked door. So if you went to push through a locked door and you couldn't unlock it, would you be able to get through it? No. You'd have to find an alternate route. So we're here, instead of hinging like our first group, they remain nice and vertical. And if you're unclear of that, go to a locked door. As you go down, you'll stay nice and vertical because the door is locking you in place. And then unlock the door. What happens? As you push into that door, it opens and you move that way. This is how the body works. And when you're looking at squats and you start to understand the trajectory and then look at, are they moving horizontally or are they moving vertically? If they're moving vertically, they're probably in a pattern that is pretty good for a squat because that's what we usually need. If they're moving horizontally, we first need to start thinking that person is unlocked posteriorly at the posterior lower pelvis. So what do we need to do to fix it? It's just the opposite. If we want that person to get out of their pattern, we need to lock what's unlocked. Locking what is unlocked changes their pattern and changes their pain. So, before we go over specific exercises to lock the posterior pelvis, we need to start to put this into practice. And as you're watching patients squat, look at the trajectory, and if they're moving in a certain space or position, that's where they're unlocked. To me, it's a really clear way to get a good plan as to what we need to do to change this person's pattern, get them out of pain, and get them moving better. Now, let's talk about specific examples as to how we can lock the posterior pelvis. So if the goal is to lock the door at the posterior lower pelvis, we want to think about 3 phases. The first phase is we need to develop awareness. How can this person change that pattern that we're looking to achieve for them if they don't even understand what it is and how to do it? In order to change something, they first need to be aware of what the heck we're trying to change in the first place. I think a lot of times we skip this phase and it leads to troubles down the road. So clear up the awareness in the beginning. And so that way, as you get to these more advanced movements, you're not going 2 steps forward for 5 steps back. You continue to make progress. So develop awareness, and we do this through education and movement. Step number 2, once they have the awareness, they now need to know how to control the new position. So a great way to do this is with isometrics. So isometrically, can they maintain a better position, one that is moving them away from their current pattern, while building tolerance and controlling that overall position? Lastly, we're looking to build strength. So once they have the awareness, then they have the control, then we build it. That's the fun stuff. That's where we can push and bring the intensity in and all the different things as far as weightlifting goes. But we're doing it in a way that they're controlling and having awareness. Now let's jump into 3 different exercises within each phase so you can understand exactly what I'm talking about. So usually if a patient is hinging when they go for a squat, like I said, they're unlocked posteriorly and locked anteriorly. So for our awareness phase, we want to start with something that's simple and that they understand. So although it's not as fun, I want to get this person understanding how to move their pelvis posteriorly and get their rib cage back. This is where something like a hook lying, hands on the stomach, posterior pelvic tilt, and breathing, get the rib cage down, goes a long ways. Why? Because we know it's the foundation, the building block to where we want to start to get this person. So when it comes to our posterior pelvic tilt, an easy way is to reference the belt buckle. Cue that patient to turn their belt buckle towards their chin. If that doesn't work, and if they're really confused and stuck, have them arch their back. A lot of people are familiar with arching their back. So from this position, we arch the back, my belt buckle would go towards the feet, and then once they're in that position, just say, okay, go the opposite way. And normally they just go right into it. And so if you start here and try to get them here, they really struggle. But if you get them at end range, into extension, now have them go the exact opposite way. This is a really good way to get someone to understand that. Once they understand that, now we need to get them breathing and exhaling through the mouth so the rib cage comes down, inhaling through the nose while maintaining the rib cage in a downward position. This overall position is what they're going to need to maintain as we move to our controlled position phase. Now that they have their awareness, we want to start to add stress and put them in a position where they can control the good position. So usually for the controlled position phase, we want to think about what constraints can we add that helps increase their chance for success and at the same time allows them to focus on their position. So something like a wall sit is a great way to increase the stress, right? Make things burn, but at the same time gives them the constraint of the wall and gives them a way that they can still focus on that position. So what we're going to do is we are going to go into a heels elevated position. The heels elevation is going to push us forward, which naturally gives us a little bit of a weight shift posteriorly. This is what helps them lock the door just by stepping foot on the slant board. From there, it's pretty straightforward. We're going to put our feet on the slant board, put our back on the wall. They are going to go into this slightest tuck, slight, nothing crazy. Just get them to that position where they have to hold it. We're going to bend to a 90-90 position at the shoulders. We're going to reach with the elbows. That's going to give us that protraction, aka rib depression. And then we're just going to push the knees forward as we hold on to all of that position, and then we'll cue them to take about 4 or 5 breaths. Look at this vertical squat. Look at this locked door posteriorly. Look at this rib cage depression. All things that we're trying to get for this type of patient. For our final phase, the strength phase, we are building strength while they have to control that new pattern. So something to improve this type of pattern and to get more of a locked door posteriorly would be a heels elevated goblet squat. Now, you don't have to be married to the goblet squat, but think of an anterior load, so it gives them a little bit more of a posterior weight shift. And the reason for the slant board, again, is to have them get pushed forward where they naturally go into a little bit more of a locked posterior pelvic tilt. So as we go through it, I would cue them to remain in that slightly elbow reach position to give them a little bit of space in that posterior thoracic region. And then all we're doing is sit straight down as the knees go forward. Notice how I said sit straight down, don't push back. A lot of times we're trying to get them to do a certain outcome and the cues we use actually contradict the action. So avoid the push back. That's what they like to do. Instead, knees forward, sit straight down. And we should be in more of this vertical position with a lot of knee flexion compared to knee extension and more hip flexion as far as our horizontal direction goes.